It's really difficult to think about how to talk about therapy in just a few minutes. So I thought that looking at some of the things in the office here might be one way to do that, to show something about how I think about therapy. This picture was painted by the Brooklyn artist Astrid Cravens. It's inspired by Dante. There's a part where Dante, following his guide Virgil, emerges, climbs out of the inferno and comes into a space where there's air and they can see the stars. The figures could be on an island or a mountaintop or a peninsula. And I think of therapy as a kind of secluded, protected, secure space in which my client and I can reflect together on where they've been, where they are, and where they'd like to be going, and especially on what it all means. This photograph is by the Milwaukee photographer Paul Calhoun. It's taken in the Republic of Georgia. A boy ascends a steep flight of stairs. They're ancient stairs, and he's coming out of the darkness and into the light. The associations with therapy are pretty obvious there. We have to step up. We come out of the darkness of not really knowing what's going on in some ways into a more aware space where we can see where we're going and have more choice. And there are ancient and modern parts of the human experience, and that certainly comes into therapy. This is a Sufi contemplation figure. I don't know how the Sufis use it, but to me, it's a wonderful optical illusion that tricks our brain in such a way that we can see it in action. We can see something of how we perceive things in action. As we look at the figure, which of course is not moving, it seems to move and reform again. That's because the brain is trying to find patterns, and it keeps finding different patterns in the picture. And that shows the process of our brain looking for patterns in life. That's how we perceive. So our experience that things are just going along very smoothly, and even of ourselves as being the same all the time, that's actually pretty much of an illusion. There is no one-size-fits-all therapy. Mostly, it's about the relationship. So the style of the therapist as a person becomes very important in the usefulness and effectiveness of the therapy. I tend to be pretty straightforward, pretty direct. I interact and talk a lot. Some people like that more than others. I tend to be somewhat challenging as well as supportive, and sometimes can be playful and humorous and so on. I'm a better match for some people than for others, and that's to be expected. What really matters is that the client finds the best therapist for their needs at the time. Astrid Cravens sent me these lines of poetry translated from Dante. My guide and I came on that hidden road to make our way back to the bright world, and no wish to care for any rest. We climbed, he first, I following, until I saw, through a round opening, some of those things of beauty heaven bears. It was from there that we emerged to see, once more, the stars.